Good morning, everyone. My name is Wendy Davis, and I'm from the New Jersey Children's System of Care, or as we're sometimes referred to, CSOC or CSOC. I would like to start by extending a warm welcome to you all today. We appreciate this opportunity, and we are excited to be able to connect and share with you today about our system with a goal of joining to support youth and families. Given this last year, we believe sharing the message of our work and resources is more important now than ever before. And I'm imagining that's resonating with you all as what you're seeing every day. Today's presentation is a joint effort by the Children's System of Care and Perform Care, and we're grateful to the AAP for arranging our time together. Once the formal presentation concludes, we will offer an opportunity during which we will address some of your questions. In order to do that, we ask that you would enter your questions in the chat feature within Zoom that we've all learned so well over the last year. We encourage you to pause on entering your questions until I invite you to do so toward the end of our presentation, as we're anticipating some of your questions and follow-up thoughts may be answered or addressed as we move through the presentation. If there are any remaining questions left unanswered at the end of our time together, we will provide a follow-up written response through a frequently asked question document. Next slide, please. Thank you. The goals of today's presentation are to provide an understanding of the functions of both the Children's System of Care and its contracted system administrator, Perform Care, and to clarify our different roles we have within the system. We will discuss our service array options that Children's System of Care offers and how Perform Care provides access to these services. We will also walk through the Children's System of Care DD eligibility process and important information that parents need to know when applying for eligibility. Next slide, please. I wanted to take just a minute to introduce our presenters today. I'm Wendy Davis, and it's my pleasure to serve as the Assistant Director of the Office of Community Services for the Children's System of Care. You'll hear more about these in a bit from my colleague, Nicholas Pecht, who joins me today. Nick works for CSOC within the Office of Community Services, and he serves as our liaison to our Children's Interagency Coordinating Councils and our Mental Health Block Planning. As well, he serves as our CSOC lead on our department's Child Stat Quality Initiative. I am also delighted to be joined by Dr. Ankur Desai, the Medical Director for Perform Care. We're going to work together today to present how we collaborate to provide a cohesive system for youth and families of New Jersey. Next slide, please. So what is the Children's System of Care? The mission of our department, which is the Department of Children and Families within which our division sits, is to assist and empower all New Jersey residents to become safe, healthy, and connected. As I mentioned, CSOC sits within DCF as a division, and we seek to fulfill that departmental mission by serving youth with behavioral health, substance use, intellectual and/or developmental challenges, and their families through a system of care approach. The system of care is a statewide coordinated network of services and supports that relies on youth and families being at the center of their own care. It aims to connect families early in their identification of need, support them within the community, and with an approach that is mindful of their cultural context, the social determinants of health, basic needs, and how these impact on families and their other needs. It is important to note youth don't need to be involved with any other system to access Children's System of Care services. Any family in New Jersey can call to access services and supports, and a standard service array is offered across all service areas in New Jersey, as you will hear. CSOC has contracts and provider agreement arrangements, as well as memorandums of understanding with other partners that support our service array and guide service delivery. Contracted services are reimbursed with federal and state funds. I just paused there because our structure really allows for that, and it's allowed us to grow in a unique way. Providers and partners are arranged in community system partner service areas that are aligned with the New Jersey court vicinages, the 15 in New Jersey. This helps assure seamless connections and coordination of care, particularly in circumstances for which youth have multi-system involvement, as our system was designed to grow a collaborative connection and relationship based system of care in which all partners come together for both individualized youth and family and system level planning for the best outcomes for our youth and families facing the needs that we mentioned. Next slide, please. Within the last 12 months, 53,280 youth ages 3 through 21 were served by CSOC. That's an estimated 1 out of every 33 children in New Jersey. And we consider that you as pediatricians may see 20 to 30 patients a day. You could generalize that a pediatrician is likely to see at least 1 youth each day that has received services through CSOC. CSOC is really the safety net for New Jersey families who are caring for youth with behavioral health, substance use, and intellectual and developmental challenges. And I say this as our services are available to youth and families regardless of their ability to pay for those services. Commercial insurance carriers do not provide the same in-community or residential service array offered by the Children's System of Care. 35% of youth who access CSOC are uninsured, underinsured, or have private insurance that doesn't cover the cost of CSOC services. And it's worthy to note that 65% of the youth have Medicaid or New Jersey Family Care coverage. Thank you. New Jersey's Children's System of Care was founded upon the system of care and wraparound values and principles seen here. And you'll see at the heart of that is youth-guided and family-driven care, community-based focus, and cultural and linguistic competent services and supports. These have informed the development and maturation of the system approach, service, and administrative components, and they continue to provide our framework for decision-making at both our individual planning and our system service level planning. The system of care model, some of you may be familiar with, is an organizational philosophy and framework conceived and developed in the mid-1980s, and this continues to transform child serving systems in states and local jurisdictions to this day. New Jersey is known nationally for the richness of our system, which we're blessed to offer, and we are often asked to provide technical assistance to other states, and we've actually been asked to provide technical assistance to other countries looking to implement the system of care values, philosophies, and approach. The system of care model involves close collaboration across agencies, families, and youth for the purpose of improving services and access and expanding connections and expanding the array of coordinated, community-based, cultural and linguistically competent services and supports for the challenges that we highlighted in the slide before and will continue to highlight. Next slide, please. The Department of Children and Families is devoted exclusively to serving and supporting at-risk children and families. It houses both the Division of Children's System of Care, which I've talked a little bit about, and our Division of Child Protection and Permanency, with which most of you are most likely familiar. We are often asked to clarify the roles and relationship between these two sister divisions, as well as the role of partners within the children's system of care. We've provided this graphic to support our discussion. The Division of Child Protection and Permanency is the child protection and welfare agency within New Jersey, within the Department of Children and Families. Its mission is to ensure the safety, permanency, and well-being of children and to support families. CSOC is the treatment arm within the department and, as mentioned, serves youth with mental health, substance use, developmental and intellectual disabilities, and their families through coordinated care, treatment, and intervention. Whether or not they're involved with our Child Protection and Permanency Division or not. In fact, most children engaged with children's system of care have no involvement with our child protection and permanency partners. CSOC is committed to service provision based on the youth and family needs in a family-centered, community-based environment, really focused on community care whenever possible. And as mentioned, encourages connection as soon as a need is identified, right, early on. CSOC encompasses state staff charged with management and oversight of the administrative, clinical, and support services provided by agencies who are contracted or in agreement with DCF. The New Jersey Department of Children and Families contracts with Perform Care to provide access to these publicly funded services through CSOC for youth up to the age of 21. Perform Care is the contracted system administrator, or CSA, for CSOC. As such, they are the single point of access to an array of services for youth and families throughout New Jersey. We want to ensure you're aware of that. And now I will turn to Dr. Desai to share more with us about Perform Care and access to CSOC services. You may be on mute, Dr. Desai.
Thank you, Wendy. Good morning, everybody. My name is Dr. Desai, and I'm a medical director at Perform Care New Jersey. Perform Care New Jersey is a subsidiary of AmeriHealth Caritas and provides integrated managed care products with a national footprint in 13 states and the District of Columbia. Altogether, AmeriHealth Caritas serves more than 5 million members nationally, with the overall mission and vision being to help people get care, stay well, and build healthy communities through our next generation model of care. The AmeriHealth family of companies workforce continues to grow and evolve over time with more than 7,300 associates and growing by the day. Perform Care New Jersey is a full-service behavioral health managed care company serving members in the public and private sector. It works in partnership with the New Jersey Children's System of Care. Next slide, please. So this slide illustrates the partnership between Perform Care and the New Jersey Children's System of Care. I'll walk you through some of the key points illustrating their relationship. The New Jersey Children's System of Care sets the vision and policy of the system, while Perform Care provides the access to treatment services 24 hours a day, 7 days a week, 365 days a year. The New Jersey Children's System of Care determines what specific data should be prioritized and collected, while Perform Care works on collecting the data, reporting the data, and presenting the data trends. The New Jersey Children's System of Care establishes the clinical criteria for each treatment service, while Perform Care carries out decision-making to authorize the treatment services in line with the clinical criteria. The New Jersey Children's System of Care manages provider contracts and provider practice, while Perform Care provides training, communication, and technical support to the provider network. The New Jersey Children's System of Care is responsible for rate setting, establishing new services, and managing funding priorities, while Perform Care is responsible for leveraging funding streams, maximizing services, and optimizing availability of federal funding participation. The New Jersey Children's System of Care defines new services and population rules, requirements, and criteria, while ensuring compliance with statutes and regulations, while Perform Care is responsible for rapid and efficient implementation of services, which in turn ensures capacity for new services and populations. Next slide, please. So our goal is to be the one-stop access point for youth and families in need of behavioral health, substance use, and intellectual disability services. Some of the more common reasons for referrals to Perform Care include youth who are struggling with depression and anxiety symptoms, youth who may be exhibiting signs of physical or verbal aggression, youth who are struggling with impulsive or oppositional behaviors, youth who may be engaging in bullying or who are being bullied, youth with underlying intellectual disabilities who could benefit from clinical services and supports, youth who are actively using substances like drugs and alcohol who are in need of clinical services and supports, youth who are struggling with grief, loss, or any form of trauma, and also helping and guiding family members or teaching staff who are concerned about a young person's functioning in the school or in the community. Now, I will hand it over to Nick.
Thank you, Dr. Desai. I'd like to now focus on the CSOC service array and specifically on our core services within the community. CSOC contracts with 15 agencies for each of these 3 system partners to provide a standard service array statewide. Building a community network of supports allows opportunity for earlier intervention and coordinated community-based care driven by family need. Our partners are operating within a wraparound model and system of care approach, as well as with a core approach of trauma-informed care and healing-centered practice. Our community partners are currently involved in our Promising Path to Success work, infusing the healing-centered approaches of 6 core strategies and Nurtured Heart approach within workforce and organizational development to better build the strengths of our New Jersey youth and family serving partners around CSOC practice, approaches, and populations served, as well as related core competency evaluation. Next slide. Mobile Response Stabilization Services helps youth and their families who are vulnerable to or experiencing a broad range of stressors, coping challenges, and emotional or behavioral needs or symptoms. Mobile Response is designed to respond to an array of circumstances, which may include youth substance use, dealing with stressful or traumatic experiences, feelings of isolation, communication challenges, and suicidal thoughts or ideations. Mobile Response is CSOC's timely, face-to-face, community-based response component. Mobile Response is designed to provide a response within 1 hour. The crisis intervention specialist's work is to hear of a need and connect with the family as quickly as possible. There is telehealth capacity during this time of public health emergency, should families request that type of response. Mobile Response aims to stabilize the youth and family system, prevent unnecessary interventions such as ER or psych ER visits, and prevent unnecessary involvement with child protection and resource care placement and with the youth justice system. Their goal is to keep youth safe at home, in the community, and in school whenever possible. New Jersey has 15 mobile response programs covering 21 counties, which allows for timeliness and flexibility of response. Families can access mobile response in New Jersey 24/7 by calling one toll-free number, no matter where they are in the state. Parents or caregivers must verbally consent for mobile response. However, you can support the family through this process if they are in agreement. Mobile response is designed to provide intervention within the community. However, they are not a substitute for psychiatric emergency services, which are designed to assess imminent risk to self, others, and property, and to facilitate hospitalization. Mobile response's crisis intervention specialists are bachelor's or master's prepared individuals who are supervised by a licensed clinician. Their work involves de-escalation of crisis situations and engaging youth and families in a process that helps them understand their needs, learn new skills, and plan for managing needs with their supports to prevent future escalation. They focus on building connections to strengths, supports, and services that can help youth and families thrive. Next slide. Care management organizations, or CMOs, are CSOC's local lead system partner, providing, through the wraparound model, comprehensive care coordination and planning for youth and their families with moderate and complex needs. Services are accessed through Perform Care, through an assessment process and determination of need based on clinical criteria. An average length of involvement with the CMO is between 12 and 16 months. The CMO works with youth and families on building a cohesive, supportive team as they drive their own teaming and planning to address their identified needs. CMO services are available to youth and their families whenever the need presents during their development. The wraparound model is an intensive, individualized care planning and management process. The model brings together the family, the professionals working with the family, and informal and community supports to create a child-family team, or CFT, which is responsible for developing and implementing a plan to meet the youth and family's needs. Youth and family voice is integral in this process. Caregivers are connected to family peer support partners when engaged with the CMO to co-facilitate the wraparound process and support family voice throughout their involvement. The CMO's frontline care managers' work is to engage with and build relationships with youth and families to support the assessment of strengths and to prioritize needs. They collaborate with youth and families to develop their child-family teams. CFT members include anyone the youth and family identify as important connections for their support. CMOs guide the work of organizing CFTs and facilitate team meetings to support the ongoing assessment and planning process. The team works collaboratively to assess and prioritize needs, identify strengths-based strategies, and implement individualized plans, supports, and services that will help youth and families meet their goals. The CFT can access supports and services, including the entire CSOC service array, coordinate insurance benefits where available, and access community supports not typically funded through Medicaid or insurance. CMO aims to maintain youth in the community for treatment whenever possible. Around 88% of youth in CMO are treated within the community. Relationships between CMO and other providers who are involved with youth and their families are key to system-level collaboration. This collaboration helps foster a better understanding of the needs of the youth from others' perspectives. To develop these relationships, please connect with the CMO leadership in your area to have a conversation. Each CMO has an executive director and operations director who are key people in system collaboration. Additionally, each CMO has a community resource specialist who has a wealth of knowledge on system resources and whose role is to coordinate the sharing of information within the community and identify new resources. Next slide. Family support organizations, or FSOs, are CSOC's family and youth peer support leader. They are service area-based organizations run solely by families of youth with emotional, behavioral, developmental, and/or substance use challenges. The peer support partners have lived experience in supporting their youth in addressing their needs. Other caregivers are afforded the benefit of guidance and support from peer support partners' perspectives. FSOs direct provide direct family-to-family peer support, education, advocacy, and other supports to caregivers who are supporting youth with emotional, behavioral, developmental, or substance use needs. Individual peer support is one service offered by the FSO and is available to families of youth enrolled with a CMO. Peer partners co-facilitate the child-family team process and develop a family action plan based on the FSO's Family Action Planning or Family Assessment of Needs and Strengths, or FANS. This service is accessed through Perform Care. The family is open to the FSO at the same time a youth is enrolled with a CMO to engage with and offer the family services. FSOs offer a variety of other supports and services, which are available to caregivers of youth with needs in the community, whether youth are involved with the CMO or not. Our youth does not have to be involved with the children's system of care for caregivers to access this set of services. These services include telephonic support during business hours that is monitored by caregivers who have or had youth with behavioral health, mental health, substance use, developmental disability, or youth justice issues. They also include support groups, such as grandparents groups, support for fathers, and nurtured heart parent groups. They also provide educational workshops and system navigation support for families. These services can be accessed by families contacting the local FSO directly. The list of FSOs is available on the Perform Care website through the Educator Specific page and the Resources page, as well as on the DCF website. Additionally, if a family calls Perform Care, the care coordination staff will also direct families to the FSOs if it can be a resource to them. FSOs are also responsible for coordinating youth partnerships. Youth partnerships are personal growth peer groups for youth affiliated with an FSO. They provide a variety of local events and opportunities for teens and young adults with behavioral health, intellectual and developmental disabilities, and substance use challenges, whether or not they have been involved in CSOC services. Youth partnerships help youth develop self-advocacy and leadership skills and work to reduce the stigma attached to having a behavioral health challenge or diagnosis. Meetings often occur weekly or monthly, depending on the service area. FSOs can reach out to families involved with mobile response stabilization services if the families desire that support, but do not offer individual in-person peer-to-peer support for families engaged with mobile response only. Peer-to-peer support services are reserved for families whose youth are involved with a care management organization. As with our other system partners, system collaboration is a key component of the FSO's work. They provide and amplify family and youth voice in local planning forums, such as the Children's Interagency Coordinating Councils, or CIACs. Next slide. The biopsychosocial, or BPS assessment, is a comprehensive assessment performed by a licensed clinician that is designed to determine the best services, resources, and/or strategies to assist youth and their families achieve success in the community. Let's review some of these services. Intensive in Community, or IIC, is a short-term, solution-focused intervention that addresses presenting behaviors that results in the youth and their caregiver gaining insight and improving function at home and in the community. IIC clinicians may provide youth and their families with an array of interventions, such as psychoeducation, negotiation and conflict resolution skills training, effective coping skills development, healthy limit setting, emotional regulation skills development, stress management, self-care, symptom management, problem-solving skills, and skill building that enhances self-fulfillment. Behavioral Assistant, or BA, is a service that is comprised of specific outcome-oriented interventions. Providers address specific target behaviors. These services help the family and youth to develop and practice healthy and positive coping strategies and techniques. I would like to note that youth must be DD eligible to access these next two services, Intensive In-Home and Family Support Services. Intensive In-Home Services, or IIH, take place in the family home and include both the parents or caregivers and the youth. These services include behavioral services and individual support, which focuses on teaching skills to the youth while training the parents. They also include clinical therapeutic treatment that again focuses on both the youth and the family. Family Support Services, or FSS, are a coordinated system of supports designed to maintain and enhance quality of life and to strengthen families who provide care at home. The different types include respite care, assistive technology, weekend or evening drop-off programs, and educational advocacy. Out-of-home treatment services. There are approximately 200 out-of-home treatment programs statewide. These programs provide a home-like environment while focusing treatment on the whole child and family system and on transitioning youth to less restrictive settings. The CMO and the CFT are involved in out-of-home treatment decision-making. CSOC contracts with outpatient and inpatient substance use disorder treatment programs throughout New Jersey. Families may access services by presenting at a contracted community agency or by contacting Perform Care to request an assessment. Perform Care uses the American Society for Addiction Medicine criteria to determine the appropriate and least restrictive level of care or service setting in order to meet an individual youth's needs and to support prior authorization of services. Available services include outpatient services, including individual and group counseling, intensive outpatient services for youth with more intensive treatment needs, partial care programs for complex needs that do not require 24 hours a day care, out-of-home treatment services and out-of-home co-occurring mental health and substance use treatment services for youth who could benefit from a residential structured environment, and withdrawal management services, providing medically monitored treatment during drug or alcohol withdrawal. And now back to you, Dr. Desai.
Thank you, Nick. Appreciate it. Now I can talk a little bit about how services are accessed through Perform Care. As a single point of access, the goal is to provide linkage with the right care at the right time. We provide access to services for all youth in the state of New Jersey up through their 21st birthday. And access to these services, I remind you, is available 24 hours a day, 7 days a week, 365 days a year. There are two main components to the call center operations at Perform Care: member services and clinical services. Member services goes through the process of registering the youth and family's demographic information, which enables them to utilize services through the New Jersey Children's System of Care. They also determine the main call reason and resolution. Member Services is able to answer questions regarding youth who are applying for DD eligibility and are calling back to check the status of their application. If a youth is homeless, Member Services can also provide resources for that young person's through the Adolescent Housing Hub. For youth in need of clinical services, Member Services refers the call to the clinical services line for completion of a clinical triage, which is completed by a behavioral health care manager. For youth who present with potentially life-threatening emergencies, the call are directed to the crisis line, which is also managed by the clinical services team. Next slide, please. And now what I'd like to do is present you with a brief video that summarizes how youth and families access New Jersey Children's System of Care services through Perform Care. This video is also available on the Perform Care website.
Developmental disabilities, or substance use challenges, the New Jersey Children's System of Care and Perform Care are ready to help you and your family when you call 1-877-652-7624. Since 2001, the Children's System of Care has been connecting New Jersey's families and young people to the care they need by helping them access publicly funded services for youth up to age 21 through the statewide New Jersey Children's System of Care. Perform Care can assist your family when your child is impacted by depression, trauma, bullying, violence, defiant behavior, drug or alcohol use, developmental disabilities such as autism, Down syndrome, or cerebral palsy. We are available to help you 24 hours a day, 7 days a week, and 365 days a year at 1-877-652-7624. There is no charge for calling Perform Care. When you call Perform Care, you will be connected to a trained associate who will ask for some information about you and the child you are calling about so they can best assist you, such as the reasons for your call, your child's date of birth, and address. If your child is in crisis, Perform Care can send a clinician to your home or to an agreed upon location in the community within an hour to help stabilize the situation and offer additional services as needed. In addition, Perform Care can help you locate the nearest psychiatric screening center or contact emergency services. Other available services include referring a child for assessment, where an independently licensed clinician can come to the home and review your child's biological, psychological, and social factors. Perform Care can also refer you to community services and/or recommendations for outpatient services. Substance use treatment services, referrals, and authorizations are available through Perform Care for eligible youth. The Children's System of Care also offers services for youth impacted by intellectual and developmental disabilities. The first step to accessing these services is to apply for eligibility for developmental disability services. Specially trained Perform Care associates are available to help explain the process. At the end of your call to Perform Care, you can expect an explanation of any services being authorized or recommended, as well as the next steps. You will also receive a letter in the mail explaining the service or services you have been authorized to receive. Beginning with just a phone call, Perform Care can help you connect your child to the behavioral health, substance use, or developmental disability service he or she needs to be well and thrive. We are available 24 hours a day, 7 days a week, and 365 days a year at 1-877-652-7624.
Thank you. So what I'd like to do is talk to you a little bit about the DD eligibility process. Perform Care manages DD eligibility applications for all youth up to the age of 18. The application and all of the information needed to apply for DD eligibility is also available on the Perform Care website. If the family does not have access to a computer, Perform Care staff can mail a paper application to the family. The length of time it takes to review a DD application depends on several factors, with the most important factor being the successful submission of all the required forms, documents, and updated clinical evaluations. Once all of the administrative documents and forms are in order and the necessary clinical information is provided, there is a 60-day time window to complete the DD eligibility determination. The clinical review of DD eligibility involves confirming a qualifying underlying diagnosis consistent with the developmental disability, which requires long-term services and supports, and assessing a youth's functional capacity across 7 domains of function. Those 7 domains are self-care, communication, mobility, learning, self-direction, community living, and economic self-sufficiency. In general, in order to be determined DD eligible, a youth must generally exhibit substantial impairment in at least 3 out of those 7 domains. Next slide, please. Now, here is a brief video which summarizes how youth and families in New Jersey can access developmental disability services through the New Jersey Children's System of Care. It is important to note that an application for DD services is not required to access crisis or behavioral health services through the New Jersey Children's System of Care. And also, this video is available on the Perform Care website.
The New Jersey Children's System of Care or CSOC, offers services for eligible youth that are impacted by intellectual and developmental disabilities, such as Down syndrome, autism, cerebral palsy, spina bifida, and seizure disorders like epilepsy. Perform Care works with CSOC to assist families who are requesting these services. To access services for children with intellectual or developmental disabilities through CSOC, families must first complete an eligibility application. In order to qualify, the child must be under the age of 18 and living with a caregiver. If your child also has mental health needs or is in crisis, this application is not required to immediately access behavioral health services through CSOC. This application is for families that wish to access CSOC services only available to children with intellectual or developmental disabilities, or IDD. Perform Care is available to help you 24 hours a day, 7 days a week at 1-877-652-7624. Step 1. Getting ready. Before applying, parents should review the Perform Care website to see what IDD services are available. A listing can be found at www.performcarenj.org/IDD services. If the service you need is not provided through CSOC, families and caregivers can look for services from other sources, such as insurance and your child's school district. You should also review frequently asked questions for families of children with developmental disabilities, the Getting Ready checklist, and the timeframes for clinical assessments available on the Perform Care website. Although the application process is somewhat lengthy, you only need to complete the eligibility application once for IDD services through CSOC. Step 2. Applying for eligibility. After reviewing the available services and collecting the required information on the checklist, you can start the application. Make sure to follow the instructions carefully so the review of your completed application is not delayed. You can apply with our online application found at www.performcarenj.org/IDD application. If you choose, a paper application is also available for mailing. Only one application is needed. When applying, you'll need your child's most recent evaluations, as listed on the Getting Ready checklist. Please also check the timeframes for clinical assessments to see if the documents qualify. If you are sending your child's Individualized Educational Program, or IEP, ask your child's school for the assessments and evaluations used to create the IEP. Also, include any clinical reports from your child's doctors. If you need help getting this information, please contact Perform Care. Another very important part of the application is the Child Adaptive Behavior Summary, or CABS. It will give us information about your child's typical daily functioning within the last 6 months. The CABS should be completed and signed by your child's primary caregiver, the person who is most familiar with your child. Step 3. After you apply. Once your application has been received, we will make sure that all required forms and documents are included. If your child's application is missing information, this will delay the review process. Perform Care will send you a letter if additional information is needed to make a decision. The letter will also explain the next steps in the application process. A clinical review and decision will be made after we receive all the required documents and confirm that the application is complete. Perform Care is available to help you 24 hours a day, 7 days a week, and 365 days a year at 1-877-652-7624. It's free to call Perform Care. Specially trained Perform Care associates are available to help with the application process. For more information, visit Perform Care's website at www.performcarenj.org. We look forward to helping your family access the services your child needs to be well and succeed.
Thank you.
Thank you so much, Dr. Desai. I appreciate that information. At this time, if you have any questions that haven't been answered, or would like us to further clarify something, feel free to enter that into the chat or Q&A if you haven't already done so. And I am now pleased to present to you our new Children's System of Care public service announcement.
Growing up can be tough on kids. So much is going on in the world that can trigger depression, anxiety, substance use, or acting out. Sometimes parents or friends just don't understand or can't relate, and the emotional distance becomes hard to bridge. We all know kids can have bad days, but trauma and life-changing events can have a lasting negative impact. Atypical or unusual behaviors that continue for more than 6 months could indicate a need for help. Don't wait. For real-time support, resources, or de-escalation counseling, call New Jersey's Children's System of Care. It's the state's low or no-cost behavioral health system for all kids up to age 21. CSOC provides free coordinated access to mental health supports, substance use treatment, and services for intellectual or developmental disabilities. Call now, 1-877-652-7624. That's 1-877-652-7624. Growing up.
Thank you. I'd like to take a minute now as we wrap up the formal part of the presentation to review what we hope some of your main takeaways will be from today's presentation. CSOC and Perform Care are two distinct entities, yet we consistently work together to ensure that youth and families are connected to the quality care they need when they need it. Perform Care is available 24 hours a day, 7 days a week, 365 days a year to assist and provide support and information to families calling and providers. Please have families call when they're first identifying a need for support, and your encouragement of them is so key. Perform Care provides access to the wide array of CSOC services that CSOC has designed and developed and implemented. And now we would like to spend a few moments. I've been seeing the questions come in the chat. We'd like to spend some time answering your questions and comments.
Hi, this is Melinda Carnisow from the Children's System of Care. When I just wanted to unmute and say, there are so many questions in the chat. I want to just assure everyone that we are keeping track of all of your questions. And if they're not addressed today, we are going to address them in writing. But there are also a number of questions in the Q&A box. So I'd like for us to start there, Wendy. But first and foremost, I just want to say several times it was asked, I believe, in the chat around if there is a youth who is noted to be a harm to themselves or others, and they may not want, to go into treatment. I think we just need to say up front, if a youth is noted to be a harm to themselves or others, we need to call 911. We need to get that youth help immediately. So you would not be trying to call Perform Care or get mobile to come out in that case. So I think that probably answers about 10 different questions in the chat. So I just wanted to get that out there. And then if you want to start in the Q&A, there's about 19 that I flagged.
Okay.
And I think Nick and Dr. Desai could probably jump in and help you with a few of them.
Sure.
Sure.
Okay, we're just going to start from the top. So does mobile response also refer to psychiatric services? So I will answer, the short answer is yes. So if mobile response is engaged with the family, they will work to understand the needs of the youth. And if part of what is needed is an evaluation by a psychiatrist or a medication management, they will work with the family to facilitate that. If mobile response goes out to a family's home and there's an immediate need because of some things Melinda just described, things escalate sometimes, they will work with the family to call 911 or the police to get the youth the help that they need, whether that's psychiatric screening or some other intervention. Okay. Moving on. I like the interactive part, so this is challenging, but so I hope that answered that question, and I think we have some other related going forward. So we were asked to repeat what we said about mobile response and psychiatric presenting issues.
I can
So-
handle that, Wendy,
Oh,
since I
okay.
was the one who was talking. Essentially, mobile response is designed to provide intervention within the community, but it doesn't replace emergency psychiatric services, right? So those kinds of services are designed to assess for imminent risk, either to self, others, or property. And they're also designed to facilitate hospitalization. So if that's where you're headed, you would want to engage in emergency psychiatric services. So I think that covers it. It was just repeating it.
Thanks so much, Nick. Yes, I think I was wanting to just add that, right, for mobile, we've worked really hard to get that to be an early intervention, because for so long, psychiatric screening was the only system around in New Jersey until the Children's System of Care that responded to needs. And we know those are imminent risks to self and other needs, right, for psychiatric screening involvement. So for mobile, we certainly respond to psychiatric needs, the service does. And that could look like someone who's very withdrawn, right? Who's very depressed and isn't interacting any longer with their peers, isn't going to school, right? That might have that underlying depression or anxiety driving. Certainly, we've seen youth who might be having a first episode psychosis. So in that regard, yes, we absolutely respond to psychiatric needs. And we also don't require a formal diagnosis or anything to respond. It's a very broad front door. So we want to just make sure that, again, that needs-driven care, if a family's experiencing something or you anticipate there's a psychiatric need that's not at that imminent risk to self or other, please have the family call, and supporting them in that is wonderfully awesome, right? That, and I know time is, sometimes it's hard to get that time too, but that's really the best. So thank you.
Just really quickly, I want to jump in. I know we're down to like 7 or 8 minutes, but I think we could probably extend for 5 or 10 minutes to answer some more questions, it looks like. So I wanted to throw another one up that keeps coming up in the chat. There's a lot of questions around the age of youth that we deal with, and if it's a hard stop at 5. So I don't know if you wanted to just touch on that. And a lot of questions around FSO and if they can be accessed directly, if you can have an FSO worker with a CMO. And now I'll mute again.
Sure. So I'm gonna take my lead from you. I'll start with the age. So we do, all of our services have criteria and includes description of age, and some of them do reference that under 5 are served on a situation by situation review, and we have a process for that. I want to highlight that mobile response is an EPSDT, an early periodic screening, diagnostic, and treatment service. So it is available to all youth under 21. And, we see not as many youth under 5 at mobile, but certainly we are available. We know that service looks different for youth under 5, and the importance of the connection to their families and working with the families to support them. So that is in terms of age. At 18, we do require that a youth give verbal consent for services. So I did see that question come up in the chat. So that's relative to age. And if anybody has anything more specific, please just write it down and we'll include that in the FAQ. With regard to family support organization, I would say absolutely families can call that FSO, that local FSO directly, and they can be supported without calling Perform Care. One service that's available is that Nick mentioned is individual support services by family support organization for youth enrolled with care management. In that instance, youth who are enrolled with care management will receive, their families receive a parent support partner, a peer support partner that will work with them around the support, education, and advocacy that Nick described. And that's a little bit different service than what a family would get by calling the FSO directly. Calling the FSO directly will get them linked to speak to somebody on the phone about their needs. It will get them connected to support groups. It could get their youth connected to youth partnership, but it won't get an ongoing peer support partner like they would get if they were enrolled in the care management organization. FSOs provide an array of different services, and those are really based on the family's needs. Melinda, I'm happy to go on. If you want to direct, I'm happy to do that as well. Do you want us to move into talking about presentations for schools or?
Yeah, I think if we do one all-encompassing response around, there's a couple questions around, you know, if we needed, if a school wanted a presentation or other places wanted more information or a presentation, maybe just addressing how Perform Care is not going to come out, or you're not going to come out, but we do have a mechanism for that.
Nick, can you take it away?
I would be happy to.
Thank you.
So each county in New Jersey has something called the Children's Interagency Coordinating Council, and that acronym is CIACC. We call them kayaks. So each of these planning forums has the capacity to present to the community to discuss the children's system of care, Perform Care, and how to get youth services. So anyone from a school can reach out to them. Many of them have specific subcommittees called educational partnerships, where education professionals can become a member of that subcommittee and help plan for their community. So, to request a presentation, you can reach out directly to your local kayak. It would be based on the county in which your school is. And I think that also covers a question regarding, like how schools can interact with the system. I think the questioner had asked about Perform Care. So you would interact with the Children's Interagency Coordinating Council. And what I'm going to go ahead and do is put a link in the chat, and that will give you the name of the convener or coordinator in each county and their contact information. And so you can shoot them an email and say that you want to get involved, say that you want to set up a presentation, either for your school district or your school, for educators, for parents. They will work with you, to help connect you to the system.
Thank you, Nick. There was also a question related to presenting for providers. So I would say, please share this information when you get it with your team of psychiatrists and social workers. And we certainly will provide like a contact point. So I'm not sure exactly where you are, but we can connect you to your local kayaks at different locations. We can certainly point you in the right direction. You'll have a contact, for us as well.
And just in case anyone did not get this message, because it's coming up a lot, next week, anyone who's registered will be provided with the presentation as in addition to an FAQ that the Children's System of Care is going to put together with all of your questions that were not able to be answered today. I think there was a question about, there's a couple questions around parents and youth calling Perform Care. So there was everything from someone under 18 who doesn't have a guardian, to someone over 18 who doesn't want services, to what if a parent is undocumented. So I don't know if there's like a blanket answer where you can kind of touch on all those pieces together, Dr. Desai.
Well, I think that, the goal for Perform Care is to be that single point of access to services. So, I think, in relation to whether if there's a young person and the guardian is not there or it's unclear, we're definitely going to kind of take the information, we're going to register the call, and we're going to kind of provide them with whatever services or guidance that we can provide them with. I think there was also an earlier question of whether only families can call for minors, for young people under the age of 18, and that I wanted to kind of open that up a little bit. Any kind of adult or a person that is a concerned person for a young person can call Perform Care if they're concerned about a young person's functioning in the community or in school. And then we can guide them through the process of kind of getting the consent and explaining that the services are voluntary. And that for people under the age of 18, you do have to get kind of consent from the guardian. In a situation where there's it's undocumented, there's an undocumented adult asking for services of their children. Again, this is not an issue that would potentially want them to be a barrier. We don't want it to be a barrier to care. So. Those are information that we're going to register. We're going to take the information down, and then we're going to provide them with whatever resources we can. I don't think being undocumented is a barrier for people to access services. So I don't know if I answered all of that, but I'm answering it to the best of my ability. That again, our goal is to be the one point of access, and there should not be any kind of hesitation to call. Whoever's calling in relation to a concern for a young person, we're going to try to point them in the right direction.
I think that's right, Dr. Desai. We want to remove as many barriers as we can, and we do have, parameters within which we work, such as, we have to have family consenting to services to access. That includes when a youth is 18, we need their consent. We know that questions have come in before in terms of guardianship for youth who have challenges with intellectual and developmental delays. We really try to focus on engagement, like Dr. Desai said. So we're going to do, the folks answering the phones will do whatever they can. So if a school calls in and a family's in need, that Perform Care coordinator or care connector may try to do a conference call with that family, right, with whom the school has spoken, but isn't yet on the call, right? They'll try to coordinate that because, again, we're trying to remove barriers. But at the end of the day, we need, that consent from a parent, that verbal consent from a parent or a youth who's 18 to be able to then move forward with the processes and the arrangement. But we're going to do our best. And that's at Perform Care, focus on engagement. That's at all of our system partners, all of our service providers. So if you have a youth who's, right, like many of our adolescents, I'll speak for myself, right, they aren't necessarily, it's their job to say they don't want to do something. So we are going to work to really engage them in that process. If mobile goes out and they say, no, thank you, we're going to work with the parent, we're going to work with them. And really our approach at youth and family-driven care is guided in that direction. Like we want to understand what is going to help us reach that youth and really hear what they're saying. And that helps with that engagement. So Melinda, I don't know if Dr. Desai and I hit all of those questions. Again, if we need to provide something in writing, we can do that. I did want to just go back to the FSO. Someone asked about coordinating counseling. So I would just say the FSOs will work with families to identify like a referral if a family is in need of counseling. It's a little different than what a care management or mobile might do in terms of coordinating with that provider to ensure connection and to ensure ongoing service delivery. But certainly our family support organizations are daily helping families identify resources where they can receive the type of support they need, whether it's counseling, whether it's around basic needs, whether it's around their own support groups and that kind of thing. So I hope that clarifies in that arena. Melinda, did you want me to talk at all about coordinating with schools in terms of like care management, out of home and or DD eligibility?
Yes,
separately?
I think there's a number of DD eligibility questions that keep coming up, some around school and school documents. One that I've seen pop up a couple times, just to start off the conversation is DD eligibility permanent, or is this something that we have to renew? So maybe we could start off there, and then move on.
Absolutely. And I'll look to Dr. Desai if you can just tag on. I would start
Sure.
by saying, we transitioned all of the youth who were served by the Division of Developmental Disabilities 7 or 8 years ago to the Children's System of Care. And now Children's System of Care is responsible for DD eligibility for youth under 18 and service provision for youth under 21. That's our
correct.
division's responsibility. And I would say we have several mechanisms in place for transition age youth, right? We really ask our teams who are planning with youth with CSOC DD eligibility to begin as the youth is turning 18 to connect with the Division of Developmental Disabilities, because you're right? There is another process that they have to go through when they turn 18 to confirm their eligibility for services through the Division of Developmental Disabilities, or DDD, from age 21 through adulthood. So
Right.
that it is not, permanent. And we do have mechanisms that connect our division with the Division of Developmental Disabilities. We communicate, that we have youth who are DD eligible, they to us when the youth are eligible through them, so that we can provide services, and us to them so that they can know these youth are transitioning into the adult system and will need their ongoing support. And there are
Right.
multiple layers of that coordination.
So I can add on that, that's spot on, Wendy. So basically, the key take home points is when a young person younger than 18, when their family's applying for DD eligibility, that's a one-time thing up until the age of 18. They don't have to do that multiple times. They don't have to do that at one point before the age of 10 and then after 10, nothing like that. It's a one-time application, and that eligibility determination is good up through the age of 18. When they become transitional age, and when they, when they become older than 18, there's that transitional period where they're still eligible potentially for, some other CSOC supports, either through the CMO or, through other types of resources through the Children's System of Care. But the actual DD services for the adults start at age 21. So really, up until the age of 18, it's about the System of Care, working with that youth and family to get the services and the resources in place to help with that transition. So that there are no drop balls between that transitional period. And what happens between the age of 0 to 18, we offer an array of both clinical and non-clinical services in terms of DD services. So the non-clinical considered services are what they call family support services, which was mentioned in the presentation. Those are things like respite, educational advocacy, resources and services like that. And then there are the clinical services in the clinical spectrum that include community-based in-home therapies, ABA type therapy, clinical therapeutic therapy, as well as out-of-home treatment services that they can also access once they become DD eligible and get connected with the CMO. That's how they access the clinical services. So I hope that clears it up.
Thanks, Dr. Desai. I also wanted to address briefly the questions around DD application. I know Dr. Desai went into that and also shared the video, and we're doing a couple of additional things we think will be helpful. We really have taken a look at the process and documentation required, and are doing our best to clarify where there's been some question about that documentation. So I know there's one question about an IEP, and then say I'm going to just fill in the blank, like a functional behavioral assessment that might be needed. So all of that in terms of what's required and timelines within which it's required are on the Perform Care website and can be accessed. And again, we're taking a look at that to ensure that we have the most clear information. Our clinical leadership group took a look at that recently, and so we'll be updating that information in the not too distant future. But there would be some additional information required, and the teams that are working with that youth and family should be connecting with the child study team if that's the mechanism via which they need to get the information. And they'll explore other areas where that information may be available to pursue the DD eligibility application. But again, our goal is to not have barriers, but to make sure we have sound information to make decisions, right, for those youth and families.
Wendy, I feel like this might be a good point to squeeze in what other languages we have a bit available for all the things that you're talking about right now on the Perform Care website.
That's perfect. So I do know that the videos do have are available with Spanish, and a number of the documents that are related to either DD eligibility or service access are available in at least 5 or 6 different languages. I don't have those right up in front of me. I don't know if Dr. Desai wants to add any information, but certainly we can share a link with you to that information. And if anyone is calling the Perform Care Access line, the 877-652-7624, there is always the availability, if there isn't someone on the floor that speaks the language of the family's need,
Right.
then there is an interpreter line that they will use to communicate. Similarly, our system partners have an expectation that their staffing is reflective of the community within which they are working. And we know how diverse New Jersey is. So sometimes there's still a need, and then they have that backup language interpreter line as well. So we have
Yeah.
both translation of documents available and also interpreter services to support.
That's correct. That's correct. There's a language line that the call center uses that basically can offer, kind of a real wide array of, languages that are being spoken with our diverse population. And that's what we utilize on the call center to, to kind of answer any questions regarding DD eligibility or any other questions for that matter. Even a clinical triage can be done, kind of through this access of the language line. In regards to the other languages where the application for DD, I'd have to check the website to kind of see which, what are the main languages that it's offered in. But I do know that, Spanish is probably one of the main ones that that it's offered in. So the video is also available in Spanish as well. So I would second that.
And Melinda, I know we had a couple of questions around connecting with care management organizations in general that provide services and supports and wraparound to our moderate and high need youth. And I was so excited to see a pediatrician excited to connect to that team. So I wanted to make sure I addressed it. At any CMO, all of our CMOs, there are 15, have an executive director, a director of operations, and a community resource director. So I'm going to put a link in the chat that will link you to their resource nets that also has contact information available for those agencies and those leaders. And you can connect to them if you want to talk at the system level. And if it's about a particular youth that you're concerned about and they're involved with the CMO, then that family drives who sits at that team, right? Who sits at that child family team and table, and you can offer to be available to them. Again, in our virtual world, it's sometimes a little easier for doctors or, out of state folks to connect and to be a part of that sustainable team than it is sometimes when we had only in-person meetings, right? Certainly positives and drawbacks to both, but in this instance, sometimes it's helpful to help you connect. So please talk to your families, ask them to bring your name to the care manager and they will connect with you. And at the system level, please reach out to the leadership regarding coordination of youth who need out-of-home treatment services and the school component of that. Our child and family teams, again, are the drivers and charged with coordination of that benefit in a lot of instances. I mean, we require that they reach out and that they coordinate that with the schools. And we do know that sometimes there are hiccups in that process. And we think it's really important for you all to bring those issues, like those specific issues, to the care management leadership so that they can understand what the learning point is there, if it's something that the staff need, if it's a particular challenge with a particular youth, and how they can better connect with you all for that youth and for all of the youth in terms of planning for out-of-home treatment and the school component that is a part of that. So again, please go to the resource nets and the links for the care management organization leadership and have those conversations. You know, again, if you're, you know, that's the first step.
Okay, thank you, Wendy. I think that's about all the time we have for questions, but I just want to remind everyone, we are going to answer as many of these as possible in an FAQ that we're going to send out with the presentation. But I also want to remind everyone to go to the CSOC website, go to the Perform Care website. Nick has also put up the link for the kayaks. I added a link for the Family Success Centers in one of the questions. So please use the resources that we've added while you wait for the information next week. And I just want to say thank you to AAP for making this possible for us and allowing us to connect with all of you today. And thank you to our presenters for doing such a great job in getting this information out there. So Lori, thank you. And I guess we will turn this back over to you.
Great. Thank you so much for your presentation today. Once again, the email will be going out next week with all of the additional FAQ and the video and recording of this presentation. Thank you so much for everyone's participation. Have a wonderful day. Thank you.
Thank you all so
Thank
much
you.
for your
Thank you very
time.
much.
We
I appreciate the
it.
time. Thank you very much.
Take care.
Take care.